Okay, guys, we have on the seat here Awo Koko Dagadu. She's a mental health nurse in Ghana. She's been doing this for over 13 years. She has a lot of experience, and I'm very glad I got the best of the best to be on this seat. So this brings us to the second part of this interview. We're going to delve deeper into what mental health nursing is, the stigma, the challenges you have at work, the challenges your facility has at work. I think that they should make you the ambassador of Pantine Hospital. The last time I was there was about maybe 6 years ago when I had to meet a colleague there, but I had also done some clinicals in there. But the whole place is so huge. You have a land that stretches way beyond, and people have encroached. I know you had legal issues with land and encroachment and all that stuff. So I'll just take it basically. What is mental health to a layman on the streets? Because quote unquote, to a layman, mental health to them is somebody who is not acting right. I don't want to use the word, but we tag them crazy. Let me just call it to make it very relatable. They think that people are crazy. That is why they are there. So what is mental health to a layman? Explain mental health to somebody who is in class 3 or class 4.
Okay, thank you for that. Mental health, okay, to a layman, as I always explain to whoever cares to listen, is that an individual's inability to adapt and adjust to his or her environment is what is classified as mental health. Okay, when we talk about mental health, it has to do with how you think, how you feel, and how you behave. Okay, so if you have a problem or you have any disturbance in the way you think, in the way you feel, and then the way you behave to people around you, even to yourself, then you are attempt to have mental illness. I always use this example. What we define as normalcy, okay, what everybody would define as, if they said I am normal, what shows that I am a normal person? What makes me normal from someone who is mentally ill? Now, when I wake up in the morning, for example, I'm expected that I'll wake up early, take my bath, brush my teeth. I have a routine I have to follow. Okay, but then someone who is having a mental health challenge is having a stress or is going through a psychological stress that we cannot see, that is affecting the person's way of thinking, and that the way you think affects how you feel and how you behave. So this person wakes up in the morning not ready to bath or not ready to even what interests the person. Maybe if the person is the jovial type, all of a sudden the person becomes withdrawn. If the person is someone who loves going to work, and all of a sudden the person decides not to go to work. I always say that mental health is just about a reduction in our normal, what we claim normalcy, either a reduction or excess of what we do. If, for instance, we are all laughing because a joke is cracked, and there's someone among us who doesn't laugh, and then everybody will say, is this person okay? Or maybe there's something that we are all laughing about. Then after laughing, everybody has stopped laughing. Then the other person continues laughing despite nothing amusing or nothing interesting is going on. Then we can say that the person is having what? Mental illness. So mental illness, as we talk about, is not just about the people we see on the street. That is just one aspect. That is just one aspect of mental illness. That is the extreme case. And because people are not aware of what mental illness is, at times you are staying in a house with someone who is going through or having mental problem, who is having psychological stress. But because you don't know, you just take it that that's how it is. But the person needs help. So to a layman, I just want to say that mental illness has to do with a problem that has to do with how you feel, how you think, and how you behave. If there is a problem with that, then you are being said to have mental illness.
Okay. So what are some of the causes of mental illness? What causes somebody to have a mental breakdown or deviation from their normalcy?
Okay.
What happens to the brain? Just a simple summary, simple for everybody to understand.
What's the actual cause of mental illness, like any other condition, is not known. The actual cause is not known, but a lot of factors have been attributed to it. which we term as internal factors and external factors, or inherent factors, meaning those things are what the person is made up of. For example, your genetic, who you are, the kind of family you come from, your personality. And then at times, you know, the brain is one part of the body. Okay, if someone is having headache, we all see the person running temperature and all that. But when there is a problem in the brain, at times we have hormones and chemicals that help us feel how we feel. So when there is any problem, or either a reduction or excessive production of these hormones or chemicals in the brain, it can predispose the person to developing mental illness. And other factors, these things have to be in line with environmental factors such as trauma to the head, accident, infection, abuse, and all that. These are the things that can easily predispose one to mental illness. Life at times stresses, someone who fails his exams, and this person has never failed psychologically. If the person doesn't know who he is, if he's having the personality that he doesn't even know who he is, then it can easily predispose that person to mental illness. Okay. So your personality, and then environmental factors, your genetics, and abuse, like social issues that tend to affect you psychologically, and your inability to relate to help yourself or seek help will easily predispose you to developing mental illness.
Okay. Thank you very much, Coco. You're so knowledgeable in this field. So what are can you give me just the basic 5 common diagnoses that we see, common mental health issues that we see? What are 5 diagnoses that we see especially nowadays, social media pressure and all stresses of life? What do people normally come and present with?
Okay, normally people come with one main diagnosis of mental illness is schizophrenia, which most people are not aware of. The public is not aware of. All they see is someone who is on the street. And then we have mood disorders. The mood disorders have to do with mania, that's bipolar, mania and depression. Mania and depression. And then we also have eating disorders, and then anxiety disorders, and substance abuse. These are just the few I can talk about now. So these are the basic ones that most of the time report. We have others which are not common in Ghana, like eating disorders and all that. So we have schizophrenia, we have mood disorders, mania, and then depression. And this depression can lead to one to commit suicide. At times when someone commits suicide, it's not just a day thing. The person has been through a lot of depression or psychological stress that maybe he didn't talk about, or he even talked about, but nobody took him or her serious. That led to that. And then we have substance abuse, which is on the rise now, especially among the youth, with all sorts of abusing of substance, and then domestic violence. Like those kind of things are some of the issues that are, or the diagnosis that come. Okay. So if a person who is having a personality type which predisposes the person to mental illness is abused, it's easy for the person to get depression. Let me put it like that. Yeah.
Okay. So you're touching on everything that we need to touch on. So what are some of the signs and symptoms somebody will present? What will somebody do that will say, oh, this person is not acting the way they're supposed to? Maybe they are withdrawn, neglecting their personal hygiene, or they are pacing, or they are stuck at one place. Can you mention some of the things we should look out for? If I live in a house with somebody and they are doing certain things and biting their fingers or something, what should I be looking out for?
Okay, so for you to be able to identify someone suffering from mental illness, you need to know the person. As I explained earlier, one's inability to adapt to his or her environment, both internal and external, is what is diagnosed as mental illness. So if you're in a house, maybe with a family member who you know that, oh, this person have a routine. Maybe the person is used to waking up early, going to work, taking his bath. He's the neat type who wake up early, he'll greet everybody, he's that sociable, he's that outgoing. Then all of a sudden, the person wakes up, even after the person not even wake up from bed, you have to go and call the person. This person will wake up and will not even want to bath. The person doesn't want to eat. The person no longer interacts with others around. Then you should know that the person is having a psychological stress. So find out what is going on. Okay, that's the only way that we can be able to diagnose someone who is suffering from mental illness or having psychological stress. So if the person, you maybe, for instance, the person is not doing all this and you talk to the person and the person seems not to be responsive, not to be open up and all that, then you have to seek help for the person. Most of the time, people who have mental illness don't accept that they have mental illness. They don't even know, most of the time, some don't even know that what I'm going through is a mental health, that I need help, because of how we have treated people over time with mental illness. So anyone you are staying with in your home, your workplace, not even at home, your church, anywhere, you see the person's behavior, the person is come to church and then the zip is buttoned the other way around. The person is talking and what he says does not follow a logical pattern, or what the person says does not make sense, then you should know that the person is having a mental health issue and needs help.
Thank you. So, how is the triage system? When I see somebody like that in my house, how do I decide where to take them to? Do I take them to, let's say, 37 Hospital, or do I take them to Accra Psychiatry? How do I know what is going on to know where to start from?
Okay, so because mental health facilities are open to everybody, if you see somebody with such an issue and you don't know what is wrong with the person, you can take the person to any health facility near you as a starting point. Okay, you can take the person to any health facility near you, because I mentioned certain things as some of the causes. Maybe the person is having a physical condition that is predisposing the person to the mental illness. So when you take the person there, we have general physicians who will treat and then refer. Okay, so if you send the person there and then the person needs further mental health care, then the person will be referred to a psychiatric hospital. But if you think, oh, from your personal assessment of the person needs to be taken to a mental health hospital, and you know anyone, you can bring the person to the mental health hospital, and then the person will be taken care of. Now we have community mental health nurses in our communities that you can fall on, and they would be of great help to you.
So are these community mental health nurses having a facility, or maybe they live in the neighborhood with you?
Yes, most of them live in the community, and then now we have a lot of mental health units, okay, attached to general hospitals. So if you send the person, as I said, if maybe you think that, oh, this person is misbehaving, but you take the person to the general hospital, there is a community mental health nurse there who can assess and treat the person and refer the person for treatment. Or if the person can treat, he can give certain first aid or care to the patient before, if there will be a need to refer the person to the psychiatric hospital, that is done.
Yes. I think because of the name of the facilities, Accra Psychiatric Hospital, Pantime, mental health, whatever, the name alone gives a lot of stigma out. It gives stigma vibe. So people are not willing to enter such a facility to seek help. And even if you hear your friend lives around Pantime, the first thing that comes to your mind is that they are mentally unstable. And it's high time we do thorough education. What are you doing as nurses to educate people, to let them know that your facility does a lot of ENT, eye, mental health issues, autism, and all these eating disorders and stuff? Is the education going on well? And what are the loopholes? What is going on? When are we going to change the perception and stigmatization of the patient and perception of the society?
Okay. Promotion of mental health, I always say that is for all of us, irrespective of where we are.
Mm-hmm.
Every nurse, every health worker, you have to be an advocate for mental health. Okay, so if somebody is, as for me, anywhere I go, I tell people that I'm a mental health nurse and I'm proud of it.
I know.
And some people, because of the stigma attached to it, they don't even tell people that I am a mental health nurse, because immediately you say you're a mental health nurse, oh, these people, they take care of the mad people. They even behave like one. But I'm proud of it. And wherever I go, I advocate for mental health care. For example, in my church, everybody knows that I'm working at Fine Hospital. So anytime somebody say, oh, I'm sick, even I'm having headache, I said, can you come to my facility? I'll take care of you. I would assist my, I'll refer you to the appropriate quarters for you to take care. And it's like anyone who comes to my facility, the person is so amazed. They said, we thought it's only mental health that you do. And I'm like, that is how society have made it. So if every nurse, every doctor, every health worker will advocate that, oh, mental health illness is just like any other condition. It's just like having been diagnosed with diabetes. It's just like being diagnosed with hypertension. And when the person is on treatment, the person is okay to live with. The person can interact well wherever he or she is. It will go a long way to help us. But within our health sector itself is a big problem. The stigma, the the issues. But I have been one advocate for mental health nursing wherever I find myself. I tell people that mental health, I even advocate for people to do mental health. It helps you to diagnose yourself, to know what happens around you. Do you get it?
Okay. Thank you very much, Coco. You making mental health sound very appealing. I'm very glad we are doing this interview because it's very informative. It's going to go out there. So everybody watching, just make sure you watch to the end. Share this video with others for, you'd also pick something from it. So now, so when somebody comes into the facility, do you admit them? Do you treat and discharge? Do you manage them? How is the routine like over the workflow?
Okay, so when a person walks into the facility, if normally, as I said earlier, most clients are brought by their families. Most people don't accept that they have mental health condition. So when the person is brought, the person goes through the records whereby his details and information are captured. And then you go through the nursing assessment, your vitals, everything is taken. Then you are taken to see the doctor or the psychiatrist. We have a psychiatrist that take care of people with mental illness in my facility. So they will do the assessment. And one thing I'm happy for in my facility is that when you come, you are not just being managed for your mental health. You are being taken care of comprehensively, total, meaning that the examination is detailed. Your history taking is from physical to psychological. So by the time you finish, you are doing lab investigations for us to identify whether there is any physical cause, and then you are doing assessment of the client at home, whatever stress that the person is going through. So by the time you go through this process and you are being taken care of, you live as someone who is completely well. So with when you come and the doctor assesses your health and there is a need for you to be admitted, then you're admitted onto the ward. That also have its own protocols and procedures that they follow. If the doctor assesses you and says, oh, maybe just when I give you this medication, you'll be able to do well in the house, they do that. So basically, that's how our process is. When you come in, if you are to be referred, some people, they come, they have physical illness, some people have been physically abused, they are referred to the general OPD, the outpatient department, to be well cared for. We have general practitioners in Panther. As I said, Panther is a complete hospital. So they take care of all that before we do the psychiatry aspect as well.
I know there are some conditions that mimic mental disorders. For instance, if you have a UTI, urinary tract infection, or you have maybe sepsis or anything, you might tend to be acting a little bit off. I know patients who have Alzheimer's, people who have dementia. I know recently a friend revealed to me the mother had a brain tumor that was in her frontal lobe. Her behavior was off. They were actually going to take her to a psychiatric facility before the doctor ordered a CT scan and an MRI, and they found a brain tumor and they took it out. And since then, she's been back to normalcy. So people should not be afraid to seek help. Education has to be done. This boils down to education, and the stigmatization has to, we can't eradicate it completely, but we can reduce it to an extent. I know people bring their relatives to mental facilities and abandon them. So my question is, what are some of the challenges? Just mentioned about 5 challenges you are facing as a mental health nurse and as a mental health facility. What are some of your challenges? Do you have the staff strength? Do you have what you need to work with? The stigma, is it affecting you? And the patients, are they a risk to your life?
You know, I always say that in life, there is nothing like a perfect area anyway. The same thing applies to mental health. And for mental health, our higher risk is sad that unlike the physical illness whereby you can easily detect through an investigation, you won't know when a client is going to relapse. But by studying, by being with the patient for some time, by observation, by our care, we are able to detect when the patient is at risk to himself or to others. So for the challenges, there are lots of challenges in mental health. When it comes to the facility, when it comes to the staff strength, when it comes to the clients. I think recently people heard of us crying over our land, a land that we have to protect, okay, for mental health delivery. Individuals are now taking them, saying it's for them. As an individual, what can I do? I just have to protest for government to do something. And we are still waiting for government to do something. Do you understand? So some of us, we feel that for these challenges to be dealt with, the government have to do a lot for us, especially when it comes to the institutions that have to provide mental health delivery. Priority to mental health should be our keynote. Priority, because mental health is not, for me, that is one challenge. Priority for mental health is on the low side. So if government can give priority to us, it will help. And we can educate people as much as we want. We can, now a lot of people are getting to know about mental health because of the issues that are happening. But then just getting the knowledge without acting, practicing it is a big thing. Okay, if we are talking about, oh, let's talk about mental health. When you need help, go for care. And I said, now financing mental health, especially my facility, is very expensive. Finance coming, that is another thing. Finance. If you are not someone who can afford mental health, is sad. It's very, very sad. You know, before then, we learned government used to subsidize for our care and all that, but the support is not coming. So most of the things, the facilities have to depend on what they generate to provide the care, and then they need the services that this client needs. So if the financial resource is not there, it makes the care very difficult. And the environment, my dear, that is what is even making a lot of people not even want to come. You know, the environment itself is a big thing. It's a big thing, because when you are coming, the facility and all that is a big thing. Okay. So all this, then the stigma against mental health patients. And you know, when patients are stigmatized, not only the patient, so the family is being stigmatized, the health care, the health provider is being stigmatized. The facility, as you said, nobody wants to come to Panta for treatment because of the ideology. But when one person comes and realizes that, oh, Panta, they are doing well, it's not only about that. The person becomes an advocate for mental health. And then the risk of injury from our clients and all that is those are some of the few that I can talk about or mention.